Welcome to Cognitive Connections, where we're dedicated to helping you preserve and strengthen brain health at every stage of life. I'm Nandita Srikumar, the president and founder of Cognitive Connections. And as a reminder, this podcast is for informational purposes only and is not intended to provide medical advice or diagnosis. And today we have with us Sira. Sira is an occupational therapist and dementia specialist originally from South Africa and now based in Gainesville, Florida. She's the creator of the Memory Bouquet communication platform and the Boats Memory Method. And her method has been used across Florida, reaching over 3,000 people and training more than 1,000 clinicians and caregivers. In addition to her clinical work, she also leads workshops and trainings that focus on improving quality of life for those affected by dementia. I'm so excited to have you here on the Cognitive Connections podcast. Thank you so much.
Thank you, Nandita. I'm glad to be here.
Yeah, it's truly an honor to have you here. And with that being said, let's jump right into the questions. So I wanted to just start off by asking, can you share what inspired you to work specifically with individuals living with cognitive impairment?
Yes, when I started in home health care about 12 years ago, I've been at OT for over 30 years, but 12 years ago, I landed in roughly 12 years time, go so fast. I landed in home care and I just realized that the healthcare community was not equipped in knowledge or in tools to take care of our dementia patients, which led to a lot of times there's no better word as to say discrimination. And we would exclude patients from certain levels of care just purely because we did not know how to help that person. So instead of allowing the person access to home care services, we might have denied them 12 years ago because we felt that the common misconception on healthcare at that time was this person doesn't have rehab potential. Therefore, we cannot demonstrate improvement to the insurance company. Therefore, we are not going to even try. So that was really alarming to me. And I just felt like we are failing our persons living with dementia as healthcare professionals. We are failing. It's not their failure, it's our failing in meeting their needs. And then that set me on a path of trying to figure out how can I equip healthcare workers to be confident and have the competence and the compassion to enter into a situation with the person living with dementia and have the ability to serve them well in that situation. So that, and then my mom, of course, lives with dementia. So that is something that's really close to my heart. And my grandpa, looking back as a child, I was 14 years old when my grandfather passed away with Alzheimer's dementia, but it's only in later life did I start to realize what challenges the family had and what my grandmother was going through. In the moment, of course, I was clueless, but looking back, I can certainly appreciate everything that she did for him and how graciously she served him through end of life. And that was part of all of those factors really inspired me that we as healthcare providers just need to do better. And so, yeah, that's my story.
Wow, thank you so much for sharing that powerful story. I can definitely see there's just been so much thought and experience that has really gone behind all of your work. And thank you so much for really doing the work that you are doing. You truly are, it's really just every step that we take that's creating a better world and a better tomorrow for all these different dementia patients. Thank you.
Amen. Together, all of us as a village,
Yeah.
with what you're
Yeah.
doing, bringing communication platform, bringing information to the public. It takes all of us. Yeah, all of us to do
Yeah.
their little piece. Absolutely.
Yeah, definitely. So what was the moment or experience that led you to develop the Boats Memory Method?
So in 2018, I was working in a small, as at that time, I was serving rural communities. Here in America, we talk about counties, and I served in Florida. I don't know if that's a thing in other states, but in Florida we have counties.
Yeah.
And I was serving 11 counties at the time, and many of them in Northwest Florida are very rural. And within that rural setting, I was serving a senior living community. And within the senior living community, that very little resources. And for the first time, I was assigned a patient in this memory care facility. Up to that point, I didn't really have a whole lot of experience because we don't have that many senior living communities out in Northwest Florida. And so upon encountering this resident, I was just struck by the caregiver's plight. So the paid caregivers, the certified nursing assistants or nursing aides were not equipped or trained to really take care of the persons living with dementia. They didn't understand the need of that person. Not only were they not educated, but they didn't have the tools to understand where is this person at in their dementia journey and what does it take from me to help them have a meaningful life. And so I just received this vision from God that this can look different. If we can communicate with our care partners in a more visually pleasing way, maybe on where their person is at in their journey, then maybe they can connect the dots faster with meeting needs such as dressing, bathing, activities, ambulating them, by just having a platform, something that they can start from, and taking some of the guesswork out. And they're so overloaded, especially in this facility. There are two care partners to 15 residents. And so most of their day was focused on just meeting the basic needs of the resident. And sometimes there's challenges, but they just didn't have the tools to navigate it successfully, which results in frustration for the residents as well as the care partners. And so that just really touched my heart. And I just felt like we just need a system as an occupational therapist, as a clinician. I called it the revolving door. I go into a situation over and over and over again, but I never am I able to leave something behind to the care partner that makes sense to them consistently. And so that was where this vision was born from. How about we use flowers to help that care partner identify the journey that their person is on, and then they can have a quick baseline expectation of what that person may need from them in order to get their basic needs met in a way that makes sense and that's not as stressful and that's joyful.
Yeah, I think that's really definitely really, really important, especially because these care partners and caregivers, a lot of times they're often spending hours and hours every single day, obviously caring for those with cognitive impairment. So it really does put a really large amount of stress, and it can, lead to more like anxiety, depression, and all of those other brain health struggles. So I think having such a memory method like the one that you were just explaining, I think can be really powerful in helping their journey.
Yes, and I think, like you said, it empowers them and it improves their quality of life, because we're not just talking about the quality of life of the resident, we're talking about the quality of life of the care partner, caregiver, so that they don't experience that burnout from having this burden placed on them that they're not prepared for, that they don't know what to do about.
Yeah. So, I know executive function plays a key role in this whole method. So, can you explain exactly what that means and how it's really central to dementia care overall?
Yes, especially within the occupational therapy role, what we are focused on is how can somebody have the most independence that they can, meaning they can connect with a task, any task of their choice, and they can feel that they have a valued connection with that task. So, for example, let me just grab my lipstick right there here. So for me, before I came into this meeting, it had meaning to put lipstick on my lips. But with functional executive function, in order for me to meaningfully engage with my lipstick, I need to know that I'm having an interview with you at a certain time. So I have to be oriented to day, to date, place, and to the event, because I don't need lipstick if I'm eating dinner with my husband, right? But I do feel like I need lipstick for the audience. So I need to be able to discriminate between the type of task that I'm going to be doing and the audience. So this takes judgment. It takes memory, a memory to remember that I have this appointment with you at 7:30, the orientation to be able to plan or sequence the steps that it's going to take for me to show up with lipstick on. So I need to know where's my lipstick. I need to be able to recognize it in the array of objects that I have on my counter. I need to be able to take it. So I need to have motor planning. That's another executive function. Visual perception is choosing the correct item. Depth perception is being able to reach the item and select it manually. And then task, I need to be oriented to task. So knowing that this is the right object for the task, and then execute the task by opening it, unrolling it, and then applying it, not like a toddler would, right? A toddler may recognize lipstick and try to apply it, but may not be as successful. So for me to be meaningfully engaged just with this simple thing of applying lipstick, it took all of those components for me to meaningfully and successfully engage and actually show up with lips that looks socially acceptable. Not too much, not outside of the lines, just right, and having it done in time for this event and appropriately. So that is executive function. That is being able to navigate your environment and choosing the correct objects, the correct interaction, and the ability to manipulate it in a motor function in order to have the result that you want. All of that is executive function. So thinking processes that involve memory, orientation, judgment, sequencing, task identification, attention to task, sequencing that task, and then having the safety or the awareness of when the task is done and what the task, judging what the task should look like. It's a very complex brain attunement that gives us that meaningful engagement. Now, that is needed for me when I wake up in the morning and I need to find the bathroom and, empty my bladder. What does that look like? Can I find the bathroom? Do I know where I'm at when I wake up in the morning? So every little piece of our day is driven by this meaningful engagement. If we're missing pieces of that executive function, then we are not going to be able to get our needs met. And that can lead to frustration, anger, outburst, sadness. With the memory bouquet, I developed the Boat's analysis of functional cognition, where I train occupational therapists to collect information during activities that helps us understand how much of that executive function is being impacted. But not only do we understand the barriers that person have, but we understand the strengths. Some of them has great attention to detail. Some people still have great judgment or great sequencing skills or critical thinking skills, but they may not have the memory. So how do we compensate? And when we score those pieces out, we arrive at the memory bouquet as far as the strengths, cognitive strengths and deficits.
Wow. So like the memory bouquet is almost like this very holistic approach to brain health, right? Using the approach of executive functioning, kind of underlaying that concept and really building on it to essentially analyze these patients, understand what are their strengths and weaknesses so that caregivers can really do their best to help these dementia patients, continue to live their life.
Yes, so this help that caregiver. I always say, I try to pull a curtain for a dark room, letting some light in
Mm.
so that the care partner can go, aha, now I understand why she is telling me she took a bath because she thinks she did, but she didn't have the memory or she didn't have the judgment to get through it in a way that actually looks or smells like she had a bath. So it helps our caregivers understand. And then it helps me as a care partner to know, so what do I need to do differently to help this person be successful when it comes to that? Yes, absolutely.
Yeah, I think that understanding also really ties in with communication at the same time. Because I think, this whole idea of memory bouquet really allows for that and really strengthens that process throughout this whole dementia journey.
Yes, that's what we hope. Yes.
Yeah. So you've definitely worked with a lot of occupational therapists and also caregivers alongside. So what kind of feedback have you received from them after they have implemented your tools?
So I not only do I train the occupational therapist who actually drives the assessment, develop the care plan, and put in place the interventions that's appropriate for that journey that that person living with dementia is on. I also have created clinical decision-making pathways for the medical professional, whether you're a nurse, a physician, nurse practitioner, physician's assistant, also clinical decision-making pathways for the physical therapist, for the speech pathologist, for the medical social worker, so that the whole team can then be in tune with how do we deliver the best kind of care on this journey. The feedback that I get, yeah, it's mind blowing. I have a nurse who said, Sira, I worked in ICU and in the hospital for so many years, and I had so many persons living with dementia come through. And I just wish I had the training that you gave me so that I could feel confident in my care for them. And she's just looking back, she said, I could have done things so much differently instead of telling them, but don't you remember? I already told you this. Or why are you pulling your catheter out? I told you not to pull your catheter out. I would have been able to handle these type of situations differently because my expectations would have been different. Um, the same with physical therapists who say to me, before I learned your method, I did not know how to approach a person living with dementia. I did not know how do I give directions to them. We rely a lot on written instructions and home exercise programs. But if what we deliver does not meet the person's ability to receive, then our delivery is not going to matter. But as a therapist or a medical professional, if we know how to change our delivery, to simplify it, to not give all that convoluted handouts, but maybe just one visual cue at a time for one specific thing, suddenly we are not getting frustrated by the fact that this person is unable to follow through at home. Something else that we've seen as far as for family members, a lot of it is just that aha moment of when we train them in the different memory bouquet levels, even before their person has been evaluated, and before that we have specifically identified where they're at in the journey, the family members already able to say, oh, I can see that mom is probably going to be a daisy because I can see these characteristics. This explains why mom gets lost when we go to the mall. Or this explains why I bring her drinks and leave it in her room, but it's always untouched. And so it just, the care partners just suddenly start to connect the dots with how they can do things differently to have success and to have joy. One good example of a nurse where a person would person living with dementia in a memory care unit, they always refused his medication. Whenever she got to him, it took her a half an hour to explain to him tablet by tablet why he should be taking it. And our occupational therapist made a list of all his tablets and what color they were and what they look like. And she's put at the top of the list, Dr. So-and-so says you have to take these. And then she taped that list by his chair. And whenever the nurse came and he was giving her resistance, she would say, look at the list that the doctor gave us. And he would look and he would say, oh, you're right. Those are my medications. And so the nurse was able to, give him his meds within 5 minutes instead of the 30 minutes I was always taking her. Another lady was resistant to go to the bathroom. She didn't like for people to tell her, you have to go use the restroom. We got their small wristwatch and we got their schedule, a toileting schedule. And she agreed. We drew, we developed the schedule with her. We taped it to her walker. And on the schedule said she has to use the bathroom. And she usually got up at the same time. And at 2-hour intervals, we had the times where she had to go to the bathroom. So all it took for the nurse was to say, what time is it? And she would look at her watch. And they would say, is it time for the restroom? And she would look at her schedule and say, you're right, it's time for the restroom. And off she would go. And so it's putting the power back in a person living with dementia so that they feel valued, heard, they have some choices instead of the care partners trying to enforce something that needs to happen at a certain time. So a lot of it is just helping care partners navigate those situations because now they know what that person need from me and able to understand and to connect with what's happening next.
Wow, that's so amazing. I think all of the stories that you just said are truly just a testament to the powerful work that you have, the powerful journey that you've created, and truly the work and the impact that you have made for, so many of these individuals across the United States and the world. And I wanted to ask, in your view, what are some of the biggest gaps in current dementia care models that your method is able to address?
So for me, from an occupational therapy perspective, I always say, we do really well at diagnosing. We, as medical professionals, that's pretty much the job of a physician, neurologist, a neuropsychologist is to diagnose. However, our patients, our persons living with dementia, our families, when they are struggling with a cognitive decline and they get this referral to receive that diagnosis, they look forward to answers. They look at that diagnostic process as I'm going to have the answers now. I'm going to know what's happening next. Unfortunately, the diagnostic process is more so for the healthcare professional to manage the disease process. So I say that there's a big gap, a big chasm, like the Grand Canyon from one boundary to the next boundary, one wall, or what do we say it, from the one side to the next side.
Yeah.
On the one side, you have the diagnoses and the clinicians making the diagnoses. And pretty much what happens is we send them off and we say, go have fun with that. We very rarely does a neuropsychologist or neurologist have resources that they can connect their person living with dementia with. That's what I hear the most. And so they can put a couple of handouts, leaflets in their patients' and families' hands, send them off and tell them, come back in 6 months to see me. Sometimes they give a prescription. And so the families leave feeling very disheartened, feeling let down, and feeling like there's no hope. This is it. There's nothing else. Nobody can help me. So what we're trying to do is build that bridge. Build a bridge from the diagnosis to what needs to happen in the home. So yes, this diagnosis is super important. We need to have that as healthcare professionals so we can manage this disease and we can monitor. But at the same time, that diagnosis means nothing to the family and the person living with the disease if we cannot impact the quality of life at home. And for doing that, we need practical solutions that's individualized to that person. So yes, we have a lot of assessments, paper-based assessments, quick assessments to get to a cognitive level, if you would, but that doesn't provide us with a bridge that connects the family and the loved ones with functional solutions. And that's what we try to do with Boat's memory method, is not only providing the family and the care partners with a map for their journey, but we're also providing the practitioners, the healthcare providers, with that same map. So now we're all operating from the same, with the same, I always say it's a roadmap. If you're a lily or a daisy or a violet or a rose or a bouquet, I can give you some road signs of what this journey is going to look for you and how to make decisions with how your brain health is going to look like and what you're going to need. I cannot predict the traffic on that road, and I cannot predict the weather on the road, but I can provide you with some road signs so that you can feel joyful and successful on your journey. And I can give you pointers of when do you maybe need to change your route and you're maybe now on a different journey. And that helps a lot with care plan decision making, and just for people to look towards the future with more hope, because they feel a little bit more empowered as to, what does this look like for me in real time?
Yeah, I definitely do agree with everything that you said. I think bridging that gap is really, really important because I think, the longer and longer that we wait to bridge that gap is just going to get wider and wider. So I think it's really
Amen.
amazing, yeah, that you're able to connect this and really make it into a bridge so that, patients are comfortable and the caregivers also know exactly how they can help their loved ones. And in that sense, how does the memory bouquet also help to reduce the emotional burden on these caregivers and care partners?
Yes, so you can see behind me the lily, which is beginning neurocognitive decline, and I'm kind of sitting in front of the daisy, but the daisy is back there. That
Uh-huh.
is mild neurocognitive decline. You have the violet, that's moderate neurocognitive decline, the rose, severe neurocognitive decline, and then the bouquet level is advanced neurocognitive decline. And so we don't diagnose. So anybody with a brain decline, it can be long COVID, it can be anesthesia. They had to have multiple surgeries and they just have delirium, or it may be somebody had a psychiatric disorder or brain injury. This assessment can be used for anybody with a neurocognitive decline. So I am just helping people to understand where they are on the spectrum of neurocognitive decline. And then coming back to your question, just tell me again your specific question towards the memory bouquet level was
Yeah.
how can the caregivers with decision making?
Yeah, and how it really reduce the emotional burden.
The emotional burden, exactly. So
Mm-hmm.
for me, it's highlighting expectations, because we tend, dementia is an umbrella term, and under the umbrella there lives 120 types of dementias. We are pretty much going to treat each dementia the same way. Yes, there's going to be some tweaks. Maybe Alzheimer's dementia is going to progress a little bit faster. Lewy body's dementia, we're going to have hallucinations and delusions. So we're gonna add in the specifics to that dementia diagnosis the person is living with. But by simplifying it in a way where we're not looking at everyone living with dementia as one umbrella, and that they all need the same from us. So when somebody hears that dementia diagnosis, they just immediately think, oh, I'm gonna have to bathe my person. I'm gonna have to, they cannot stop, they have to stop driving, they have to stop cooking. I'm gonna, they're not, everything is gonna be microwave meals now because I don't want them to touch the oven. But breaking down expectations and kind of bridging the fears, once again, where person have understanding that on the Lily journey, I can still be driving. I can still manage my own medication if I'm given a system. When I'm a Daisy, there's a few things we need to watch. We need to watch how they manage their finances. If they're insulin dependent, we want to give supervision. We want to not to have them drive on their own to a to a appointment because they may not grasp all the information. But for the rest of it, they may be able to just function fine with some intermittent supervision. But now when I get to the violet journey, now I need to start thinking about um, this is 24/7 care. Am I going to be the one who does it? Am I going to incorporate my brothers and my sisters? I'm going to pull in paid caregivers. So we're trying to give people a more realistic understanding of the amount of burden that this is going to add to them so that they're not assuming unnecessary burdens, but also at the same time being able to have joyful connections. Because even if your person is a violet, that doesn't mean, we always say dementia might steal your mind, your memory, but dementia is not going to steal your heart. The heart is still there. And if you know how to connect, how to approach your person on a violet level, if you know how to set up their daily schedule, if you know to anticipate to their nutritional needs, their hydration needs, their hygiene needs, you can keep them comfortable and happy, and you can have time for joyful connections because we'll show you how to set up an activity or an interaction in a way that is pleasing and fun and is not stressful. So I think through that approach and care partners and family members understanding the expectations in a more tangible way, they're able to have getting back to empowering everybody involved so that they feel more in control of what's coming next. And I think with dementia, it is such a highly emotionally charged diagnosis. And once you are in that elevated emotional state of either receiving the diagnosis or having a loved one who received the diagnosis, it's very hard to bring that calmness back into your brain where you can actually see hope and see joy. And it takes a professional, not just me, any professional, but someone with passion to give you a tool so that you can start that journey with more compassion and confidence. And that's what we're trying to do, is just giving you something that is tangible, that provides that hope, and breaking it down, break the challenge of dementia down into manageable pieces.
Yeah, I definitely agree. I think with the whole process of caregiving, it can be really, really overwhelming and extremely stressful for all these caregivers and care partners. And I think one of the best things about this memory bouquet and this whole memory method that you have developed is that it really does break everything down into tiny digestible pieces. Instead of shoving all of this information that, often comes from the doctor all into their face at once, I think breaking it step by step, saying, hey, this is what we're going to do for step one. Here's step two. Here's step three. I think that just simplifies it so much better for all of these caregivers and care partners. And that's truly the help that they need. It's really about breaking it down and making it easier so that they can almost lighten their load while also helping to take care of their loved ones.
Yes, absolutely. And talking about that, we are in the process of developing an app, and as some piece of that will be free to download. And within that app, we really try to give those tangible nuggets and pearls for all the different areas within your day that may be challenging, and then how to navigate that to make sure that your person stays independent as long as possible. So I'm trying everything, these days, like you were saying, we have information overload. We live in a era where it's just information everywhere you go. And how do you, first of all, get to information you can trust, and then to information that is going to make an impact, a true impact on how you and your person living with dementia walk your journey. And that's really what we're looking for, is just us to improve that journey.
Yeah, that is definitely so true. I think there's so much information, but I think, the whole memory bullets method is just really helping to consolidate all of that down. And I just wanted to say thank you so much for taking the time to be on the Cognitive Connections podcast. It was just truly amazing to learn about your work and truly the profound impact that you have created on this world. Thank you so much.
Oh, that's my pleasure. And thank you for what you're doing. We definitely need this type of information to get out there. So thank you for having me. It was my pleasure.
It was on my honor too. And to everyone, thank you so much for listening today to the Cognitive Connections podcast. And remember to keep your brain healthy and see you next time.